When someone experiences a stroke, especially an ischemic stroke, the most common type, their brain's capacity to control vital functions can be compromised within minutes. One of the earliest and most critical impairments involves the loss or weakening of the swallowing reflex. This occurs because the region of the brain responsible for coordinating the act of swallowing is frequently affected by the sudden reduction in blood flow. Scientific studies report that up to 65% of stroke patients experience temporary swallowing difficulties, known as dysphagia, in the first 24 hours. This symptom can easily escape notice, since a person may appear conscious and even able to speak, but subtle or complete loss of swallow coordination significantly raises the risk of aspiration. Allowing a stroke patient to eat or drink, whether it's water, milk, or even nutritional supplements, poses a serious hazard. When the swallow mechanism is impaired, liquids and food are likely to divert into the lungs instead of the esophagus. This can cause choking, airway obstruction, or more insidiously, aspiration pneumonia. In worst-case scenarios, the patient may go into respiratory arrest or develop life-threatening lung infections. This risk is not avoidable by subjective observation, because there is no reliable way for a non-specialist to detect mild or partial loss of swallowing reflex just by watching the patient. Even if the patient seems alert or is capable of answering questions, they may still lack the control needed to safely swallow. Thus, absolute avoidance of all oral intake, including even water, is a vital life-saving practice until a thorough medical assessment is performed by professionals. In medical protocol, securing the airway and monitoring respiratory function always take precedence. Only after specialist evaluation can nutrition and hydration resume, either through tested swallowing or, if necessary, through intravenous fluids. This is not superstition, but a clear evidence-based precaution rooted in the physiology of stroke and patient safety.